So let's start ORS. Before we begin our chapter, let's get to some introductions. Body fluids. Body fluids are intracellular or extracellular. Extracellular again divided into intravascular, extravascular. ঠিক আছে? So fluid movement something known as Stirling force. পড়েছিস ফিজিওলজিতে? ঠিক আছে? So if this is the capillary wall, so there is this capillary hydraulic pressure, then there is this colloidal osmotic pressure of the vasculature, then there is this colloidal osmotic pressure of the tissue. So colloidal osmotic pressure prevents water from leaving, and capillary hydraulic pressure forces water into leaving. তো কোথায় এটা কাজটা সবচেয়ে বেশি হয়? ক্যাপিলারি তো বটেই, কিডনিতে। ঠিক আছে? So then we come to hormone maintaining homeostasis. There is something known as arginine vasopressin. শুনেছিস? কোথা দিয়ে বেরোয়? So arginine vasopressin released from posterior pituitary. ঠিক আছে? When it is released in response to higher osmolality. এদিকে আয়, এখানে বস। এ কোথায়? কি জানো? করণ কুমার। আর ও ঘর চলা গয়া, नहीं मिला। सचदेव এখানে বস। ঠিক আছে? Arginine vasopressin is released from posterior pituitary in response to increasing osmolality. What is the normal osmolality of body? Huh? 290 কে বলছিল। ঠিক আছে? 295 to 275। ঠিক আছে? 285 on an average. ঠিক আছে? When the osmolarity crosses 285, this arginine vasopressin is released. কি করে arginine vasopressin? Firstly, it increases the thirst, stimulate the thirst center. তাতে কি হয়? Increase water intake. Then second function, retention of water and electrolyte in the kidney. So it starts to conserve water because osmolarity is high. So it has to maintain osmolarity, it starts to conserve water. তোর নাম কি রে? দিবান। তুই আগে কোনোদিন এসেছিলি? এখানে বস। প্রচুর নতুন নতুন মুখ আজকে। Another function of vasopressin is it causes constriction of the vessels, thereby maintaining blood pressure. So in short, vasopressin maintains the homeostasis of water in the body. Then the chief ion in the extracellular region, sodium chloride and bicarbonate. Sodium is the cation, this two are anion, and intracellularly it is potassium and phosphate. So if body fluid is lost, what is the maximum amount of ion that will be lost? Sodium and bicarbonate. ঠিক আছে? of importance, ক্লোরাইডও লস হবে, ঠিক আছে, পটাশিয়ামও লস হবে। Then we come to some disorders. Hypovolemia. What do you mean by hypovolemia? Huh?
Decreasing blood plasma.
Decreasing body fluid.
Blood plasma.
Huh? Somewhat right. ঠিক আছে, decreasing circulating body fluid. So what do you mean by circulating body fluid? Intravascular or extravascular? Okay, extravascular body fluid. Then hypervolemia বেড়ে গেছে। Then hyponatremia
Sodium count.
আর hypernatremia. What is the normal range of sodium? 135 to 145, ঠিক আছে, 135 to 145 is the normal range of sodium. So suppose there is hypovolemia. So hypovolemia may occur in, give an example. Acute road traffic accident, that diarrhea, burn, ঠিক আছে। So hypovolemia, so our focus will be on hypovolemia. Then sodium, hyponatremia, dehydration and surgery and burns, ঠিক আছে। hypernatremia, kidney problem, ঠিক আছে। What will happen if there is excess of arginine vasopressin? Regarding sodium, hypernatremia, hyper, ঠিক আছে। So there will be retention of sodium. আচ্ছা, so বল। না, ভলিউমের সাথে লিঙ্ক নেই, ইট কজেস হাইপারনাট্রিমিয়া, ঠিক আছে। So there is complicated system of arginine vasopressin beyond the scope of our class. So let's concentrate on our subject, diarrhea. So in diarrhea there is hypovolemia and hyponatremia, ঠিক আছে। So hyponatremia you mean below 135, ঠিক আছে। So that is hyponatremia. So what is the problem with hyponatremia? What is the problem with hyponatremia? Now sodium is the main cation in the extracellular region. When there is loss of sodium, the osmotic pressure will start to decrease in the extracellular region. That will lead to relative increase in the intracellular osmotic pressure. So water will flow from extracellular, from extracellular it will flow to intracellular. বুঝছিস? You look so confused. ঠিক আছে, water will start to flow from extracellular to intracellular, leading to swelling of the cells. So which tissue is more susceptible? Brain, the neuronal tissue, ঠিক আছে, is more susceptible. তাহলে কি হবে, যখন হাইপোনাট্রিমিয়া হয়ে যাবে তখন কি হবে, কি সাইনস এন্ড সিমটমস দেখা যাবে? হ্যাঁ, ভুল বকা, ঠিক আছে? there will be disorientation. Sajdeva, are you getting? After a long time. So there will be disorientation. First of all, there will be thirst because of activation of arginine vasopressin. Then there will be disorientation, fatigue. ঠিক আছে? So what will happen in diarrhea? Hypovolemic hyponatremia. তাই তো? So give an example of hypervolemic hyponatremia. হবে না, ঠিক আছে, ছেড়ে দিই। Let's concentrate on diarrhea. So it will be a case of hypovolemic hyponatremia. So pH imbalance. You heard of this term, metabolic acidosis? Here. There is loss of bicarbonates. Then alkalosis. ঠিক আছে। Respiratory acidosis. Let's concentrate on metabolic acidosis and metabolic alkalosis. So what will in diarrhea, the predominant fluid that is lost is intestinal fluid. Intestinal fluid is alkaline in nature. So what will be the pH? মেটাবলিক অ্যাসিডোসিস হবে, ঠিক আছে? তুই বুঝতে পারছিস লাল জামা? Okay. So question to you, what will happen if there is vomiting? No. Ball, Ovik ball, what will happen if there is vomiting? একটা না হলে আরেকটাই হবে, ঠিক আছে? So vomiting, gastric fluid is acidic in nature. There will be loss of acidic fluid, ঠিক আছে? So there will be alkalosis. দিশা বুঝতে পারছিস? দিশা বুঝতে পারছিস? জেগে আছিস? তো কনফিউশন কেন? বল কি বলছিস? কোনটা? ভমিটিং এ কি হবে বল? অ্যাসিড তো বেরিয়ে যাচ্ছে, তাহলে কি হবে? অ্যালকালোসিস হবে। আর ডায়রিয়ায় কি হবে? অ্যাসিডোসিস হবে। Is everyone clear? Huh? There is something known as anion gap. শুনেছিস? Anion gap. So anion gap is sodium minus chloride and bicarbonate, ঠিক আছে? তাহলে for diarrhea it is normal anionic gap, hyponatremic acidosis, ঠিক আছে? ঠিক আছে? ক্লিয়ার? Normal anionic gap, hyponatremic acidosis. So these are the metabolic change in diarrhea. So principles of management. The other day we were talking that we need to replenish the fluid and electrolyte that is lost. Then we need to correct the underlying cause, and if there is pH imbalance, we have to correct it. So what pH imbalance are we expecting in diarrhea, Sajdeva? What pH imbalance? pH is decreased. So what will we do? Bicarbonate. ঠিক আছে? So we need a bicarbonate supplement. ঠিক আছে? Now one thing about hyponatremia, when there is hyponatremia, the hyponatremia needs to be corrected. কি করে correct করবে? কি করে? How? কি করে? Now remember one thing, when hyponatremia needs to be corrected, it has to be corrected very slowly. ঠিক আছে? IV দেওয়া হয়, but it has to be corrected very slowly. There is something known as demyelination. শুনেছিস? When there is correction of sodium, sudden rise in osmolality may lead to damage to the oligodendrocytes. ঠিক আছে? That leads to demyelination. The most susceptible region of the brain to get demyelinated is pons. Pons কি করে? motor function. ঠিক আছে? That may lead to quadriplegia. Quadriplegia মানে? Or 4 limbs are paralyzed. এ কাজী বুঝতে পারছিস? ঠিক আছে? So underlying cause, what is the most common underlying cause in Bengal? What is the most common underlying cause? Amoeba. ঠিক আছে? তাহলে আন্ডারলাইং কজ যদি অ্যামিবা হয় তাহলে কি রিমেডিটা কি হবে? বল সেটা কি? মেট্রোনিডাজোল। আগের দিন হলো তো, ডিসকাশন হলো তো, তাহলে সব চুপ হয়ে রয়েছে কেন? So ORS, learn this new formula very well. বুঝলি? Learn it very well along with the composition and the osmolarity. So this ORS is being dissolved in 1 liter of water. Now which water to dissolve in? Clean drinking water. Clean drinking water বলতে if the source of the water is clean, it's okay. Distilled water কেন ইউজ? ঠিক আছে? If you are using packaged water, packaged drinking water, that is okay. If you are having doubt whether the water is clean or not, in that case boil water for 20 minutes. ঠিক আছে? Then cool the water, take 1 liter of water, dissolve it, then have it. So how much time it can be kept? For 24 hours. Once the ORS is dissolved, it can be used for 24 hours. After 24 hours, it needs to be discarded. ঠিক আছে? Once it is dissolved, you have to use it within 24 hours. Then what are the roles of each of the components? Sodium, আগের দিন কারা ছিল? প্রথমেই হাইপোনাট্রিমিয়া। সোডিয়াম লস হচ্ছে, ভাই অনুষ্কা বল। সোডিয়াম গ্লুকোজ ইম্পোর্ট হচ্ছে সেই জন্য। রোল অফ সোডিয়াম, so the other day we discussed, so there is something known as sodium potassium sodium glucose symport, হ্যাঁ বলেছিস, ঠিক আছে? So there is something known as sodium glucose symport. Symport কি করে? So one molecule of sodium and one molecule of glucose are transported together from the lumen of the intestine into the body. ঠিক আছে? So sodium increases osmolality, and that draws in fluid. So what is the role of glucose? এটাই সবাই বলে না, হ্যাঁ, glucose causes absorption of sodium, ঠিক আছে? এটাই সবাই বলে, glucose energy provide করে, glucose does provide energy, but in this case you can give high energy food, but I am not giving high energy food. So glucose in this case, the role is to transport sodium by sodium glucose symport, ঠিক আছে? That is the role of sodium and glucose. Then potassium, so there is loss of potassium in diarrhea, so you need to supplement it. Citrate কি করে, how? Citric acid তো, হ্যাঁ, how? এটা মানে নিয়ে যাবে সেটাকে সোডিয়াম আর so citrate breaks down into bicarbonate within the body, and that bicarbonate is used to correct the metabolic acidosis. আমি তুই বুঝছিস কিছু? তোর বন্ধু কোথায়? বাড়ি, এখনো বাড়ি? So citrate is for correction of metabolic acidosis, ঠিক আছে? আর ক্লোরাইড একটা সল্ট হিসাবে দিতে হয়, সেটা ক্লোরাইড দিচ্ছে। So osmolality, sodium is 75, glucose is 75, ঠিক আছে? ইকুইমোলার দেওয়া হচ্ছে, যতটা সোডিয়াম দেওয়া হচ্ছে ততটাই গ্লুকোজ দেওয়া হচ্ছে, তাহলে অ্যাডভান্টেজ কি হবে? হ্যাঁ, সিম্পোর্ট হবে। আর so in older ORS the osmolarity was 311. তাহলে নর্মাল বডি অসমোলারিটি কত? 75 to 295. So this osmolarity is hypoosmolar. Sajjita bhai, you are getting it? Yes. বহুদিন পরে। So osmolarity, this is hypoosmolar. ঠিক আছে? So hypoosmolar absorption will be better. তাই তো? Because the osmolarity is low, water will have a tendency to flow from lower to higher osmolar. suppose আছি, বুঝেছিস? ঠিক আছে, পরীক্ষার খাতায় সব ভুলভাল লিখে আসে। ঠিক আছে, this part please know for new ORS, only the new ORS know the exact composition and the osmolarity. যদি ORS আইডি তে পড়ে তাহলে কিন্তু অ্যাসোসিয়েটেড কোশ্চেনে এটা দেবেই। If ORS is in the ID, associated with question will be the composition and the osmolarity. Get prepared. Potassium loss হয় সেটা ইয়ে করে। So rationale of ORS, co-transposition of sodium and glucose. ঠিক আছে, আইসোটনিক or হাইপোটনিক? হাইপোটনিক 245 করে দিচ্ছি তো, আগেরটা একটু হাইপারই ছিল। ঠিক আছে, এখন হাইপোটনিকই করে দেওয়া হচ্ছে। So molar ratio of glucose and sodium are equal, তাহলে সিম্পোর্ট দিয়ে ট্রান্সপোর্টেড হচ্ছে তাই ইকুয়াল দেওয়া হচ্ছে। enough potassium and bicarbonate or citrate to compensate loss. আচ্ছা, এখানে citrate ভেঙে citrate is being converted into bicarbonate. So what is the problem with bicarbonate? Bicarbonate can be given, bicarbonate is used, so the bicarbonate is used as medication. So this glucose starts to react with bicarbonate. Bicarbonate reacts with glucose to produce sulfuryl compounds. So the formulation is destroyed. sulfuryl ring পড়েছিস কেমিস্ট্রিতে? সার্চ করে দেখবি। ঠিক আছে, so glucose reacts with bicarbonate. So bicarbonate is not given, citrate is being given, that is being converted to bicarbonates. আচ্ছা, এটা হলো। So classification of dehydration আগের দিন করানো হয়েছিল, বল ক্লাসিফিকেশন বল। বল কাকে বলবো সিভিয়ার ডিহাইড্রেশন? দেখ একবার খুলেও দেখিসনি কি পড়ানো হয়েছে। ঠিক আছে, so this is dehydration, classification of dehydration for children. Why is diarrhea is being given so importance in children? ঠিক আছে, in children diarrhea is caused mostly due to rotavirus. Rotavirus vaccine is also being introduced in the national immunization schedule, rotavirus vaccine. ঠিক আছে, so rotavirus cause diarrhea in children. So diarrhea is one of the important cause of mortality for children. So special importance are being given to diarrhea in children. Where is? So no dehydration, some dehydration, severe dehydration. So any two of them if positive, that is the dehydration. So appearance, no dehydration, well and alert, eyes are normal, thirst, drinks normally, not thirsty, skin pinch, goes back quickly. Now what is the significance of skin pinch? The skin target depends on your hydration of the body. So if the hydration is low, so skin pinch will go back slowly. Skin pinch টা কোথায় দেখা হয়? Abdomen. ঠিক আছে? Then some dehydration. কি হবে? Irritable, restless. ঠিক আছে? So there is hyponatremia that will cause this irritable, restless characteristics. Eyes will be sunken. Then thirsty. Arginine vasopressin will start its action that will induce thirst. Then skin pinch, go back slowly. Then severe dehydration. কি হবে? Lethargic, unconscious, floppy. তাহলে hyponatremia is increasing. Then eyes are very much sunken. Then thirst, drinks poorly. So is ORS a good remedy? No. ঠিক আছে? You need IV replacement of fluid because patient cannot drink at all. Skin pinch goes back very slowly, more than 2 seconds. So this is a classification for children's. ঠিক আছে? Any two or all, if any two of them are positive, then that is the classification. বুঝলি? Then signs in adults. কি হবে? First sign will be increase of thirst. AVP will set its action. Then weakness, fatigue, postural dizziness. Then dry oral mucosa, মুখ শুকিয়ে যাবে. Have you seen dehydrated patient out here? So there will be dry oral mucosa, then diminished skin target, then oliguria. Body will start to preserve water and salts. ঠিক আছে? I'll leave this to if it goes to very high level dehydration, তাহলে কি হবে? Shock. What do you mean by shock? হ্যাঁ তুই কি বলছিস? বল, যা বলছিস জোরে বল। না ও বলে দিয়েছে, ঠিক আছে? So decrease hypoperfusion in vital organ. ঠিক আছে? Hypoperfusion of vital organs. Then hypotension. So there is loss of fluid that will cause hypotension. Then tachycardia. When there is hypotension, there is tachycardia. হয়তো? কি বলছিস? হ্যাঁ ঠিক আছে, হাইপোভলিমিয়া হয়ে গেছে, increase cardiac output, there is sympathetic overactivity leading to tachycardia. Vasoconstriction, what causes vasoconstriction? arginine vasopressin. ঠিক আছে, প্রেসার মেনটেন করার চেষ্টা করছে, causes vasoconstriction. Then vasoconstriction, cyanosis, the peripheral organ may be devoid of blood supplies. ঠিক আছে, altered mental status due to কেন হচ্ছে altered mental hyponatremia এর জন্য? homemade ORS. Now ORS are listed in essential medicine. What do you mean by essential medicine? A deep ball. What do you mean by essential medicine? Essential medicine কি? সাজদেবা বল essential medicine কি? What do you mean by essential medicine? নুরুদ্দিন ওরকম বললে হবে না। Essential medicine comes as a short note. Do prepare it for short note. ঠিক আছে? So essential medicine should be present at all time in adequate amount. ঠিক আছে? So ORS is in the list of essential medicine almost all countries. ঠিক আছে? So if in case it is not available in the pharmacy, so what can we do? 6 level teaspoon of sugar and half teaspoon of salt in 1 liter water. So citrates are absent, potassium is absent. ঠিক আছে? Another 8 teaspoons sugar plus 1 teaspoon salt in 1 liter water. So what does it does? It corrects the sodium and fluid. ঠিক আছে? Not the potassium, not the bicarbonate, but it corrects the sodium and fluid. So the last one is little complicated. 3/4 tablespoon of salt, half teaspoon baking soda, 1 cup orange juice and 4 tablespoon sugar. So the orange juice is for citrate. ঠিক আছে? আর বেকিং সোডা bicarbonate acid. ঠিক আছে? So it addresses the problem of acidosis. Spoon is equal to 3 teaspoon. Most probably. হ্যাঁ? এটা জানার জন্য। ঠিক আছে? If there is some essential emergency. Rice base ORS. তো হঠাৎ রাইস বেস করছি কেন? চিনি লবণ পাওয়া যাচ্ছে না। No, it's not for that. So rice contains বল সাজদেবা বল starch. ঠিক আছে? Rice contains starch. It also contains some amount of protein. Now this starch is broken down by amylase into glucose. So why starch is being used? Now this starch is insoluble in water. Starch is insoluble in water. So what purpose does it serve? কি হয়েছে? So because it is insoluble in water, the osmolality is further reduced. ঠিক আছে? 241 ওটা ছিল, গ্লুকোজের অসমোলালিটি বাদ দিয়ে দেওয়া হলো, একটা ইনসলিউবল স্টার্চ ইজ বিং অ্যাডেড, সো দ্য অসমোলালিটি ইজ ফার্দার reduced, more and more hypotonic solution, and this starch is slowly being hydrolyzed by amylase. So there is slow release of glucose. ঠিক আছে? Slow release of glucose for prolonged period of time. তাহলে একবার দিলে অনেকক্ষণ থাকবে। ঠিক আছে? বুঝেছিস? ঘুমোচ্ছিস তো? হ্যাঁ, So তাহলে 50 গ্রাম of rice powder boiled for 8 minutes in 1.1 liter water in lieu of 20 gram of sugar. ঠিক আছে? Then cooled other salt is added. Acha, but it has to be used within 6 hours. Sajdaba, are you getting it? Ashodhan? Yes, sir. So indication যদি এটা if the ORS is being given, indication will be asked. তাহলে কি mild to moderate dehydration, সবাই যেটা বলে ডায়রিয়া, ঠিক আছে? So let's get a case where there is severe diarrhea and patient is unconscious. Will ORS be helpful? Will ORS be helpful? বল অনন্যা। তাহলে when answering, be specific. Mild to moderate dehydration, ঠিক আছে? সিভিয়ার ডিহাইড্রেশনে পেশেন্ট অজ্ঞান হয়ে উল্টে পড়ে রয়েছে, তাকে ওআরএস দেওয়া যাবে না। You have to go for IV therapy. So be specific. Then heat stroke. So if there is excess of sweating, water is lost, along with it salt is lost, so causing heat stroke to bolchi, তাহলে causing hypovolemic hyponatremia. So that can be corrected using ORS, ঠিক আছে? Then in sports খুব ঘাম ঝরানো হচ্ছে, ঠিক আছে? জিমে প্রচুর ঘাম ঝরানো হচ্ছে, so that electrolyte can be replenished. So there are some other condition like salt wasting nephropathy, chronic persistent diarrhea, short bowel syndrome, ঠিক আছে? chronic diarrhea তেও ইউজ করা যায়, ঠিক আছে? Then we come to monitoring. ORS তো দিচ্ছি, কাজ করছে কিনা কি করে বুঝবো? How do we check whether the hydration is adequate? So what do we get? Give improve skin turgor. তাহলে in dehydration the skin turgor was low, skin pinch goes back very slowly, so skin turgor must improve urine output. So in dehydration there was oliguria because the body was conserving water, so output of urine must be improved. Puffiness of eyes indicates overhydration. তাহলে কি করব? What will you do? हर्षवर्धन की करब? क्या करना है? If there is puffiness of eyes, हाँ ORS বন্ধ করে দেবো, খুব সহজ জিনিস, ঠিক আছে? ORS বন্ধ করে দেবো। Now in case of malnutrition, the eyes and face may already be swollen. Malnutrition patient আসে? কেন আসে না? In protein allergy malnutrition there is edema, swelling of face and eyes. In that case assessment may be deranged. বুঝেছিস? Caution. So ORS is a safe drug, it can be used in almost all population. So caution is being executed in case of vomiting. ভমিটিং এ কি হবে, বেরিয়েই যাচ্ছে, ঠিক আছে। So patient is having ORS and vomiting it out, so no hydration is being achieved. So in case of vomiting কি করতে হবে, IV. Then hypernatremia, সোডিয়াম বেশি আছে, ঠিক আছে, আরো বেড়ে যাবে। Now limitation is only a supportive therapy. Suppose if there is a infection of Shigella, রক্ত আমাশা হচ্ছে, it can only be supportive therapy, ঠিক আছে, it won't cause the eradication of Shigella. In that case you have to give antibiotic or whatever may be the organism or whatever may be the cause, underlying cause, that has to be addressed. So underlying cause needs correction. Advantage, effective, very effective in achieving hydration. Safe, almost no ADR, almost no ADR. Convenient, so you have to take the ORS pouch, open it, mix it in 1 liter of water and consume it orally. Anyone can do it, ঠিক আছে। So very convenient, affordable, কি আছে, নুন আর চিনি আছে, ঠিক আছে, very much affordable, affordable dehydration therapy. So during Bangladesh Liberation War, this ORS, homemade ORS was being broadcasted in radio. You know, cholera was endemic out then, so this formula of ORS being broadcasted in radio to correct dehydration. Dosage, আচ্ছা কতটা খাবে, how much will the person take? As much as he or she can take, ঠিক আছে, যতটা খেতে পারে ততটা খাবে। Person will be thirsty, ঠিক আছে, thirst center will be stimulated, as much he can take. Frequency বলে 1 to 2 teaspoon every minute for babies, ঠিক আছে। Duration, now ORS therapy is given and hydration is checked after 4 hours. If there is no improvement, to go for IV. আচ্ছা, nutrition, if the baby is being breastfed, breastfeeding should continue. If that person wants plain water or any other fluid, that can also be given. All normal nutrition must continue, ঠিক আছে। এই হীরক ঘুমাচ্ছিস, so IV dehydration when it is needed, when there is severe dehydration, fluid loss is more than 10% of body weight, there is vomiting, weakness, stupor, so the most appropriate IV formulation is ringer lactate, ঠিক আছে। Your KDT-pathy says that ringer lactate is the most ideal IV fluid, but in Harrison they prefer normal saline with bicarbonates, ঠিক আছে। So yeah, since we are in pharmacology department, we will go with KDT. জিঙ্ক কেন দেয় আগের দিন বলেছিলাম ডায়রিয়া প্রিভেন্ট করে ফ্রিকোয়েন্সিটাও করা হ্যাঁ কি খাচ্ছিস so it causes early recovery so nowadays everything is ready to consume ঠিক আছে if you cannot arrange for anything so these ready to drink ORS are present in pharmacy খুলবে আর খাবে ঠিক আছে বুঝলি so the last slide protection to children other than the ORS you must maintain certain hygiene hand washing proper food and nutrition proper fluid proper sanitation vaccination against all disease vaccination against rotavirus ঠিক আছে vitamin A maintains the integrity of epithelial cell ঠিক আছে